Dr. Bharti Yadav. My age is 74 years and I was suffering from osteoarthritis of both the knees. Right knee was badly affected, left knee was not that bad. So I consulted doctor and he said that I have to get operated for the right knee, and left knee he left it to me. It is up to you whether you want to get both the knees or only one knee. So I went for both the knee transplant, TKR of both my knees.
And she was fine for a year and a half after that, but she always felt a little heaviness in one of her knee, though she did not have pain for a year and a half. And then so that continued, and then all of a sudden she started getting a little bit of swelling and pain.
So I came back to Delhi where I was operated, and the doctor also said that nothing is wrong with my knee.
And then eventually through mom's friend, doctor friend, we came to know about Dr. Simon.
So I approached Dr. Simon and he got a technician scan, bone scan done for me, which showed infection in the left knee.
Sometimes, like all these people who present with low-grade infections in the knee, nothing was apparent on the outside. The skin looked normal, there was no redness, there was no fever. All these patients with low-grade infection of the after knee replacement usually have only pain and difficulty in walking.
And Dr. Simon decided, he said, you are having infection and you have to undergo 2-stage revision.
In the first stage, what we have done is we have removed all the old implant and the old cement and all debris and dead material inside the knee from the first surgery. We also have placed an antibiotic coated mold inside the knee. What this mold does is that it allows the knee to move even after the surgery. She had this impression that after the surgery she will be bedridden, but no. Even after removing the implant, these specialized molds are so good that the patient is able to walk around, move around, do all her activities, and without being on bed, her pain goes away.
After surgery, they made me walk the very next day and I was able to walk. I had no pain and I'm very much satisfied with my surgery.
Once the infection will settle and we will be sure that there is no infection, she will undergo a second surgery, which is actually called the true revision surgery.
I would like to thank Dr. Simon and his entire team and this group of physiotherapists and Max Hospital, for such a warmth and care that they've given us and to the patient.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.